My name is Michael Stein, and I serve as Dean ad interim of the Boston University School of Public Health. On behalf of our school, welcome to today's public health conversation. These conversations are meant as spaces where we come together to discuss the ideas and issues that matter most for health. Through a process of conversation and debate guided by expert speakers, we work to build approaches that get us to a healthier world. Thank you to everyone who helped make this conversation possible. Special thanks to Veronica Wirtz and our co-hosts at the BUSPH Emerging Women Leaders Program and to the BUSPH Dean's Office and Communications team. The future of public health depends on cultivating the next generation of leaders with emphasis on creating pathways for groups which have been underrepresented in leadership roles. Today, we will discuss how we can better support a pipeline for women's leadership in public health. In doing so, we will discuss how we can synergize these efforts with the broader work of shaping a more inclusive approach to public health leadership. I look forward to learning from our speakers today. I'm now delighted to turn things over to our Associate Dean for Diversity, Equity, Inclusion, and Justice, Dr. Yvette Cozier. She will introduce our speakers and lead today's conversation.
Okay, thank you for that introduction, Dean Stein. I now have the privilege of introducing today's speakers. First, we will hear from Dr. Mayowa Alade. Dr. Alade is the Special Advisor to the Coordinating Minister of Health and Social Welfare in Nigeria. In this role, she provides technical support to various landmark healthcare transformation and reform programs, including the Nigeria Health Sector Renewal Investment Initiative, through the sectoral-wide approach anchored around reducing maternal and child health outcomes in Nigeria. The Human Resources for Health Policy Managed Migration Policy, the Social Action Fund, among others. Dr. Alade holds a medical degree from the University of Ilorin, Nigeria, a master's in public health from the University of Glasgow, UK, and a Doctor of Public Health in Leadership, Management, and Policy from Boston University School of Public Health here in the US. Then we will hear from Dr. Emelia Benjamin. Dr. Benjamin is a Boston University Chobanian and Avedisian School of Medicine, J. and Louise Coffman Professor in Vascular Medicine, School of Public Health Professor of Epidemiology, and the inaugural Medical Campus Associate Provost for Faculty Development. A Framingham study investigator and Boston Medical Center cardiologist, she is an international leader in the epidemiology of atrial fibrillation. She has been continuously NIH funded since 1998 on grants related to atrial fibrillation, vascular function, inflammation, mobile health, and chronic pain, with an H index of greater than 200 and greater than 800 publications. An Association of American Physicians member, she has won national awards for research, education, mentoring, and diversity. Finally, we will hear from Rosemary Morgan. Rosemary Morgan is a research professor at Johns Hopkins Bloomberg School of Public Health in the Department of International Health and the Associate Chair in Inclusion, Diversity, Anti-Racism, and Equity for the International Health Department. Dr. Morgan co-directs the Gender and Health Summer Institute and coordinates the Gender and Health Certificate at Johns Hopkins School of Public Health. She is recognized as a specialist in gender analysis in health and health systems research, interventions, and programs, as well as leading projects focused on gender responsive monitoring, evaluation, and women's leadership. I will start with Dr. Alade, and I will turn things over to you this time.
Good morning, everyone. Oh, sorry, it's afternoon, actually. Good afternoon, everyone. I'm so glad to be here with you all today. I'm really honored to be given this opportunity to talk about building pipelines for women's leadership in public health. Just give me a second and I will share my slides. So when we look at public health, especially in countries, low and middle income countries like Nigeria, and even globally, we see that women bear a disproportionate burden of disease and death. But we realize that even though women bear this disproportionate burden, the women in leadership are limited. We have few women being represented in leadership positions within the community, within facilities, within institutions, and even at the high level, at a higher level of policy making, we see that women are underrepresented. For instance, when we look at the health workforce in Nigeria, we see that among the frontline health workers, we only have about 70% of health workers are women. But when it comes to decision-making positions, for instance, when it comes to commissioners of health, we only have about 6 women who are commissioners of health compared out of 37 commissioners of health in the country. Also, when we look at geographical regions, looking at the rural areas, ethnic, sorry, please hold on a second. Sorry about that. When we look at other underrepresented groups from rural areas, ethnic minorities, and disabled individuals, we find that they as well face different systemic barriers to attaining high-level leadership positions. And the reason for this is that there are several cultural and structural factors that restrict women and marginalized groups from attaining their leadership roles, even within global health. And so for us to be able to build a sustainable and equitable and a quality health system that is trusted by the citizens, we need to include more women in leadership positions. And so there are different factors, both systemic and sociocultural barriers, that affect women attaining leadership positions. I've listed about 5 different factors. Looking at the community, there are different sociocultural norms that prevent women, for instance, from attaining, going to school. And so this brings about barrier in education, and so women who are not educated can't really attain leadership. They can't even get into leadership roles. We see access to education, for instance, we have, in Nigeria, we have just about 38% of women are not educated as compared to 20% of men that are not educated. So without education, how do women have employment? How do they get to be empowered or have the power to be able to make decisions within their homes and within their communities? The first thing is about lack of mentorship and sponsorship. For women, mentorship, having that guidance to be able to navigate your leadership journey, it's compared to men, it's limited. The mentorship among women, the mentorship for women, it's even within the workspace, even in social platforms, the mentorship is really limited. And even within workspace, women having access to sponsorship, someone who can sponsor them, who can mention their names in places where decisions are made to be able to, rise in their career, it's limited as compared to men. And the last one, it's in terms of the norms within institutions and within countries, where it favors men attaining leadership roles as compared to women. And so to be able to address these different sociocultural barriers, if we look at the life course approach, we see that at every milestone in the life course, we have opportunities for addressing these different challenges, starting from the cradle even to adulthood. At a tender age, a small child being exposed to seeing a mother making decisions within the household, being exposed to even cartoons, even media that portrays women in leadership roles. When we start so young, then we reorientate women, children to understand that they too can attain leadership roles. So we need to start young. As children go into schools, how are we ensuring that we have children, out of school children, back into schools, and making sure that even while they're in schools, that they are involved in, they're taking part in opportunities that expose them to different activities that will help boost their leadership skills. And as they move on to adulthood, within the workplace, how are we need to look for the opportunities that ensures that these different women have opportunities to network. They have opportunities to be involved in mentorship programs. They have that individual who can sponsor them and make a case for them to rise in their career. And so for us to be able to address these different sociocultural and systemic barriers to building the pipeline for women's leadership, I came up with 5 building blocks. The first one is on advocacy. So working with communities, the traditional leaders, the religious leaders, to engage with them, to make them understand and change some of their cultural and social-cultural norms, to understand that women can engage in leadership roles. Also, the media, what information, having media information that projects women, that it's normal for women to take part in leadership role. The second one is in terms of access to education. We know that when you empower a woman with knowledge, when you empower her with knowledge, then she becomes enabled to be able to make decisions for herself and for her family. And this can also help her to be able to get gainful employment. And the second one under access is in terms of capital. How do we ensuring that women have access to financing in terms of empowering them, making them be able to be self-employed. The third one is in terms of agency. How are we promoting women's agency within their homes and within their communities, within their workplace, by empowering them with knowledge, by empowering them with funding. The fourth one is in terms of network in terms of sponsorship. Improving sponsorship for mentorship for women, improving sponsorship for women. And then the last one is in terms of policies, ensuring that we have institutional reforms and policies that caters for women within the workplaces, caters for ensuring that we increase the quota of women that are in leadership position, increase the quota of women that are being employed, increasing the quota of women that even having access to education. In terms of, we have different existing platforms that can help, that we can leverage to have inclusive leadership, looking at different mentorship platforms like the Women Lift Health Initiative, which is global. Right now, they're moving across, they're moving globally to other parts of the world to develop leadership skills for women, so that women can build their skills for leadership roles. The other one, especially in Nigeria, is that we have this Nigerian Young Professionals in Public Health, which has a potential to be the pipeline of women leaders. Within these different platforms, we can work with them to identify women from marginalized communities. We can work with them to develop different models and different platforms for women to be able, for different marginalized and even women to build their their leadership skills. The last one is in terms of the National Health Fellowship Program that we recently launched in Nigeria, where within this program, we have about 36 women, 36 of them are women, and some of them come from marginalized communities that are affected by conflict. How can we leverage this platform to connect them with different mentors that can help them improve their leadership skills, with mentors that can help them even build on their that can give them psychotherapy because of the different experiences that they must have gone through because they're from conflicted areas. And so in looking forward, there are different levels that we can, hello, can you hear me?
Yes.
We can hear you.
So looking forward, there are different levels that we can work on to build women's leadership, looking at different levels at the high level, looking at government and policymakers. How can they can enforce that for leadership roles that their quota has been earmarked for women, that there's equal representation. Even if you don't have equal representation, we should move towards increasing the number of women in leadership roles. The government and policymakers can help fund fellowship and training programs that can help build, encourage women to build their skills so that they can attain leadership skills. Secondly, is in terms of the academic institutions. Can these academic institutions provide scholarships for people from students from underserved areas within rural communities, for children from low income households, so that they can have access to education? And we know that educating a child then gives them the opportunity to have gainful employment and also rise within their careers. The third one is in terms of the non-governmental organization and civil societies. Can they help build mentorship programs that can work with women, help mentor women, and also help amplify the voices of women in an underrepresented population within the global space? The last one is on donors and international partners, making sure that within the projects that they are funding globally, that they have a gender inclusion or a gender lens to whichever programs that they design. And so, in conclusion, there are a few key takeaways that I would like to give. The key takeaway for me will be in terms of, for us to be able to build a pipeline of women leadership, pipeline of women in leadership, it's cut across different, multi-sectoral, cut across different multi-stakeholders and different levels. We need an intersectoral approach whereby we work with different line ministries with education to improve access to education for young girls, for girls out of school, working with women affairs to increase women empowerment, and working with the Ministry of Finance so that they can provide financing to empower women within communities. The second one is in terms of engaging with traditional and community leaders so that we can engage with them so that they can change the social cultural norms that limit women's leadership, and also engage with them so that they can also support these women to attain leadership roles and encourage women to take up these different leadership roles within the community. The third is in terms of key takeaways in engaging with men as allies. We need men so that they can have within institutions and even within countries, they can begin to, make women inclusion in different policies that they make, so that there can be a gender lens to different policies that encourages women to take up leadership position. Fourth key takeaways in terms of leveraging existing networks. We need to leverage different mentorship platforms that exist. So we encourage women to take part in these different mentorship platforms. For example, the Women in Global Health platform encourage women to take part in this because they help increase leadership skills, help increase broaden network for women. And lastly is working across the public sector, having that collaboration with public sector, with the civil society, with private sector, so that they can, or we can jointly work together to increase fellowship for women, increase mentoring opportunities, and also provide leadership accelerator programs. Thank you.
Thank you. Thank you so much, Dr. Alade. Next, we will turn to Dr. Emelia Benjamin for her presentation.
Thank you, Dr. Alade and Dr. Cozier. That was a very, very inspiring talk. And hopefully you can now, can you see my screen?
It's coming up.
Yep.
Yes, we can see it.
Perfect. So it's really an honor to be here. I have a secondary appointment at the School of Public Health, and some of my most wonderful collaborators are at the School of Public Health. I thought I would take a very personal look and sort of lessons along the line of my leadership journey, and hopefully you can find them informative for your own journey. When I characterize my leadership journey, it's been a very, very long and winding road, and I'm kind of fond of saying that I've managed to have a couple axle breakers, detours, car crashes, etc. And I'm fond of saying that the reason why I do faculty development is because I've managed to make every mistake there was to be made in having a career, and hope those who come behind me don't make the same mistakes. A lot of what I've learned in my journey is that I have a lot of old stories that I tell myself that no longer serve me. And what I've learned throughout the course of my career is it's very important to reframe some of these old stories. So I'll start out with an example that when I think of mentoring, I used to say that I've had the good, the bad, the ugly, and the evil when it comes to mentoring. And I guess my reframe would be that I learned something from every single mentor, even my most difficult mentors. I learned something from. Probably one of the reasons why I've received mentoring awards is because I've learned, not going to do that to my mentee. And I've also learned really content from every single mentor. One of my more difficult mentors taught me how to write a paper, and so we can learn something even in the most challenging context. Dr. Alade focused on the role of sponsorship. And when I was early in my career, I sort of had this story that if I just outworked every person, every man in the room, every white man in the room, that somehow people would magically notice me and I shouldn't have to ask for sponsorship. And my reframe is that unless you ask for what you need, you're not going to get what you want. And the further reframe is that we need to create cultures of 360-degree sponsorship. So maybe the people ahead of us aren't going to sponsor us, but maybe one of our peers can. I actually have had some of my mentees sponsor me. And so there's lots of opportunities for sponsorship. Another theme that I would emphasize is that I've had a fair number of career challenges. For people who submit NIH grants, this is a rather ignominious screenshot of 7 grants in a row that I managed not to get funded. And initially, I went into this kind of pit of shame and kind of considered myself Boston University Medical Center's biggest loser. And my reframe that is going to be incredibly important as we go forward in this profoundly challenging time that we're in the United States is shots on goal. We're going to just have to apply for more grants. I also have had other career challenges. 2014 was a year where I had a lot of setbacks in terms of my funding, in terms of my evaluations at work, and I had the ignominious circumstance where I think I'm probably the world's only epidemiologist to be sued for her research. And I was sued for medical malpractice for my Framingham Heart Study observational study work. As they say in medicine, you never want to be an interesting case. My reframe is what doesn't kill us makes us stronger. That was an unspeakably hard year for many, many reasons. And I would say that getting through that year made me a better parent, a better doctor, a better mentor, a better partner, a better friend. Another opportunity for reframing is I am somebody who, through much of my life, has seen the glass half empty and really had this narrative that resilience was something you were just born with. And in the process of getting through that unspeakably challenging year in 2014, I had to think about, well, how am I going to do this? Because some years are really, really hard. How am I going to grow my resilience? We know in public health that it's important not to wait until a disease occurs. We want to practice and do secondary prevention. We want to practice primary prevention where we treat risk factors. And more importantly, we want to get upstream of the risk factors and practice primordial prevention. And so I've thought a lot about individual practices for primordial resilience, the importance of perspective. I mean, that's one of the things of working at an urban safety net hospital is that I recognize that my worst days are better than some of my patients' best days. I focus on my half of the chessboard, my response, my strategy, a lot about networking, collaborators, peer mentors, understanding that some of my worst setbacks have been profound opportunities to clarify my values and redirect myself. When I was on trials, the one and only time I got 8 hours a night sleep and exercise for an hour to 2 hours every single day, thought a lot about practicing gratitude, about, practicing compassion for myself and my colleagues. Dr. Alade already talked about the importance of mentoring and sponsorship. I also have relied on coaching, thinking a lot about my breathing and being more emotionally aware, and then also appreciating the importance of humor and irony. And we also need to be doing this in a bigger reframe, to be thinking, particularly in this very challenging time culturally in the United States, is we need to have institutional antidotes to burnout. Watching our colleagues, setting workload limits, boosting control, recognizing and celebrating micro wins. When we have setbacks, approaching it with a growth mindset, having zero tolerance for incivility. And in my particular role, I've been focusing a lot on faculty development. Another thing that comes out a lot in this time for the United States is we've been doing an enormous amount of calling out of each other. And my reframe is that we need to be calling in as, this, not to be solipsistic about the United States, but we actually have many, many things that we have in common with our colleagues, regardless of what their political persuasion is. And let's focus on that and the way to move forward. So the final slide is really going to focus on sort of what is the sort of meta summary of my leadership journey. And I think my old story is that I've failed a lot. My mini reframe is failure is a first attempt in learning. And it's always wise to quote Nelson Mandela, which is, I never lose, I either win or I learn. So really radically embracing a growth mindset. Thank you all so much for your attention.
Thank you so much, Dr. Benjamin. That was wonderful. Next, we will turn to Rosemary Morgan.
Hi, everybody. Thank you so much for inviting me here today to speak to you. It's a pleasure to be here with you all. I will go ahead and share my screen. And thank you for both of those really interesting talks. very different perspectives. And I myself is going to be coming at this from another perspective. So I am a research professor at Johns Hopkins Bloomberg School of Public Health, and I'm going to talk to you today about a research project that we have just sort of wrapped up and haven't published yet on transforming health, the role and impact of women leaders in the health sector. So some of this data has already been given to you, but why are we here today? Why is this important? We know that, from a health systems perspective, women make up the majority of health workers globally, around 70–75%. Yet we don't see this reflected in leadership positions, and leadership positions in the health sector, global health more broadly, only about 25% of them are made up of women. So despite women making up a significant part of the health workforce, they're significantly underrepresented. And we know this leads to gender biases in research and policy making, and that we really need to be enhancing women's leadership to address these disparities, foster inclusive decision-making, and benefit global health systems and outcomes. We know who has a seat at the table matters. It matters in terms of what is given priority, what decisions are made, what is allocated funding. And we also know that individuals tend to prioritize things that are important to them or relevant for their lived experience. So having diversity within leadership is extremely important. We know that women face many specific and unique challenges, and many of these have already been brought up. These challenges are very well documented, related to just general gender bias and discrimination, lack of representation overall, limited access to networks and mentorship, as what has been discussed, different cultural norms and expectations, both around family support and caregiving responsibilities, but also who makes up a good leader, what are good leadership traits, funding and resource inequities in terms of who can get training, invisibility of women's contributions, as well as outright sexual harassment. But within our work, we saw that despite these barriers that women are facing, or perhaps in response to them, women leaders are making an impact. So our study really attempted to go beyond these well-documented barriers to identify these areas that women leaders are making an impact, to really help inform investment, programming, and policy. So our overarching aim was to explore women leaders' meaningful or unique contributions to reproductive, maternal, newborn, child, adolescent health and nutrition, as well as immunization. Look at the outcomes and impacts likely achievable without them, and the influences and processes that led to this. We really wanted to create empirical evidence on the impact of women leaders. So to move beyond these barriers, anecdote, and assumptions. We know that women leaders are successful. We know that they make a difference. But often it's due to our own stories or our anecdotes, right? We really need concrete evidence to help inform investment into women's leadership. I mean, I wish that arguments around the greater good were enough, social justice arguments were enough to encourage investment, but they just in reality aren't. And that we often do need to make a business case for something so we can get funding and investment. We need to do that in gender and health a lot. And we think we need to do this in relation to supporting investment in women's leadership and the pipeline for women leaders. So we went out first and we did a scoping review to explore what the impact of women leaders were. We looked across sectors, not just the health sector. We found 137 articles, only 6 focused on the health sector, which showcased the limited evidence documenting women's leadership. And we found that overall, women leaders were having positive influence in 6 broad areas: financial performance, risk and stability, innovation, engagement with ethical and sustainability initiatives, health outcomes, organizational culture, climate, including reputation, employee retention, team cohesion, communication, and then also influence on other women's careers and aspirations. And even in these studies that reported mixed findings, there was still largely a swing towards positive results. And this study was published fairly recently. So our Thrive study was a mixed method studies, which we looked which identified women leaders, influence, and impact in these spaces in East, West, and South Africa. We did this in collaboration with partners in Ethiopia, Madagascar, and Zambia. We did a multi-country online survey to capture perceptions of women and men leaders on the impact of women leaders, as well as key informant interviews, and then the in-depth case studies in Ethiopia, Madagascar, and Zambia. I'm not going to spend too long on methods just for time, but just to let everyone know, we did distribute a survey. We did a very comprehensive stakeholder mapping exercise to identify women leaders. And we'll be publishing, hopefully, this stakeholder mapping exercise soon. And then we use this to reach out to women leaders and men for the survey. And then the key informant interviews was a targeted subset of those who did the survey of women. And you can see there how we define leadership. So leaders were defined as those who occupy a position which gives them influence and power over identifying priorities, providing strategic direction, allocating resources and decision-making at multiple levels. Here are our overall numbers. I'm predominantly just going to focus on the key informant interviews today. So we did 35 of those. You can see our numbers across the survey and in-depth country case studies as well. Before I get into the specific results, just some framing. We know that women leaders influence health outcomes and impact through many of the same mechanisms that men do, such as through engagement in policy-making processes, engaging decision makers, fostering collaborations, using evidence, capacity building, role modeling. But we also know that not every woman leader will achieve the same impact or conduct their leadership in the same way as we've identified in our findings, and that male leaders can and do have similar impact. But in aggregate, we are finding or have found that women leaders are broadly having meaningful or unique and positive impacts on health outcomes. So what are some of the ways that they're having an impact? Through engagement, firstly, their engagement often focuses on neglected and/or women-centric issues. So issues really focused on women, women's health, for example, or marginalized groups such as persons with disabilities. That they're often utilizing their identities and experiences as women, mothers, caregivers, and which enabled them to connect with families and other women at a personal level, providing access to spaces that men often couldn't get access to. They're actively advancing supportive environments for other women. They're prioritizing activities which address barriers to reaching women and women's participation at the programmatic level, and advancing outcomes through collective leadership. I'm going to focus just on the last three today, because I think these are particularly relevant for our conversation around building pipelines for women leaders. So one thing, and we've already heard this from previous speakers, that enabling environments are so important. And we are finding that women leaders are actually actively creating supportive environments for other women. These activities included advocating for equal pay, implementing sexual harassment policies, establishing flexible working policies, establishing family leave, maternity leave policies, nursing rooms, conducting trainings, capacity building, and providing career and mentorship opportunities. And these activities are really important for increasing job satisfaction, increasing retention rates, and improving productivity. We can see from this quote from the respondent in South Africa, they're really talking about advocating for policies on maternity leave, as well as allowing mothers to leave work to take their child to the clinic. The next finding I want to highlight is their women leaders' prioritization of activities which address barriers to reaching women and women's participation. We often talk about this in relation to gender integration and gender speak. And these activities included ensuring women's representation as beneficiaries, engaging women in the community as implementers, and developing male engagement strategies. I wanted to highlight this one because leadership happens at all levels. It's not just at the very top. It's happening at homes, it's happening in the community, it's happening in our interventions, and that we can also encourage a pipeline of women leaders in these spaces. So these activities promoted community engagement and impact generation. This quote is from the same respondent in Nigeria. You can see here at the top that they're talking about engaging men, and at the bottom, they're talking about empowering women as implementers in their project. And then the last finding I wanted to highlight was about the advancement or how these outcomes are often advanced through women's collective leadership. We're finding collective leadership to be very important, and that women leaders are coming together to advocate for issues that are important for them and for implementing these issues, projects related to these, even without male support. And here you can see this respondent is talking about coming together as women and speaking to women legislators to move the issues forward. I think this was related to HPV programming specifically. So how can we build pipelines for women leaders? We need to invest in women leaders, and we have the evidence to support the impact of this investment. Women leaders create enabling spaces for other women to thrive, and without their influence, organizations may fail to create environments that are conducive to the success of other women, resulting in the loss of valuable talent. By investing in women leaders, we're closing persistent gaps in underrepresentation. Women leaders are serving as role models and mentors, inspiring and supporting the next generation. Again, caveat, not all women, but our findings are suggesting that a lot of women are doing this. More women in leadership positions will ensure the creation of more enabling environments, but we do need male allies, and this has already been discussed. Men need to also help to support these initiatives and create enabling environments. And it is very important that leadership is diverse and that women and men from diverse backgrounds are represented. We know that women are going to face distinct and different barriers based on their intersecting identities, and it's very important that we don't treat them all the same. I just wanted to close here with just a shout out to a book we published on women and global health leadership, power and transformation. I was the lead editor in this book. There's a lot of different research on women's leadership and barriers to women leaders, but we also do have interviews with key women leaders in their leadership journey. If you're interested and have trouble accessing this book, please do reach out to me and let me know. And just lastly, I wanted to thank our collaborators on this project. You can see them particularly Dr. Anna Kobarczyk, who is my co-PI, and then our in-country collaborators as well. And our funders, which were Global Financing Facility and the Gavi, the Vaccine Alliance. And with that, I will close.
Thank you so much, Dr. Morgan, and thank you to all of our speakers for their presentations. We will now move to our moderated discussion with all speakers. So if you don't mind to unmute your screens, Dr. Alade. And as a reminder to our audience, we will turn to audience questions at about the top of the hour, and ask you to please submit your questions using the Q&A function, not the chat, but the Q&A function, and we will try to get to as many of those questions as we can. So to our speakers, again, thank you for those great those great presentations. So again, just talking about your own lives, why was mentorship important, and how did you specifically benefit from it? I know that you've interwoven some bits of that in your talks, but can you say a little bit more about like the mentor that either you remember today or had really some transformative impact on your career?
I'm going first?
Sure, absolutely.
Okay. Thank you so much for that question. If I reflect on my leadership journey and how mentorship has helped me, I'll start off by talking about when I started my career, my public health career. So I moved from clinical practice, working as a pediatrician in Nigeria, and then went off to do my master's, and then came back home to practice public health. But then I was working as a clinician, and so transitioning into public health was a little bit challenging for me. And at that point, I wished I had mentors within the workplace, people that I could count on, that could guide me on how I navigate this transition from clinical practice to public health. But I really didn't find. In the workplace, it was challenging. even among peers, it didn't work out. And so I had to go through my first transition, the first few years of transitioning into public health, pretty much on my own, with some support from my peers, my team members, but there was not that one individual that I would call this was my mentor. And so after some time, after about 5 years within the public health space, working as a public health specialist, I then came to the Boston School of Public Health to do my doctorate in public health leadership, management, and policy. And along the way, I met a professor who, I would say, sorry to say this, was God sent to me, because the first time I met her and we talked, we connected. And some of the experiences I had in terms of the kind of person I am, my personality was similar to hers. And I got comfortable sharing my vulnerabilities with her. And along the way, throughout, she helped me to navigate the academic program, and also provided me with, connect with the network I needed even after finishing. So it was, apart from the academics or advising on my dissertation, beyond that, even career opportunities, she would send me different links to job opportunities. She would link me up. Oh, why don't you talk to this person? I think you talking at this forum will help you, or meeting up with people. She would send me things. And then we had we had maybe bi-weekly check-in, or how are you doing? What are you thinking about? How are you progressing? And I think that really helped me. And that was the first time I had a mentor. And I realized that I wouldn't have had it challenging in the first few years of transitioning to public health if I had a mentor. And so I took on myself that wherever I go, wherever I find myself, I must identify that individual that would understand my personality, not judge me, and provide me with the guidance that I needed to both navigate the workspace and also my personal life. And now in my current role, working with the Minister of Health in Nigeria, though the mentorship, I would say, with my professor in at the School of Public Health was more active, but for this, it's more passive, like an observatory mentorship. But I've learned so much. And beyond the passive mentoring, the sponsorship, it's also there. So I would say for me, that's been my experience, and I value it. I think it's very important to help you. They share their experiences with you, they guide you so that you don't make those kind of mistakes that they made. They coach you, right? And also help you expand your network. And where your name needs to be mentioned, they mention your name, that why don't you consider this person? Why don't you, so I feel like having that mentor who truly believes in you when you doubt yourself is really important. Thank you.
Yeah. Would anyone else want to add?
Sure, I can come in. I was reflecting on this question and thinking about my own journey, and that, I haven't really had many mentors in my career, or ones that I was be able to identify. And that, it wasn't until I came to Johns Hopkins, and I worked at a couple other universities before coming here, that I started to sort of identify that I had a mentor, and that it came about really organically. We are often in our jobs sometimes assigned a mentor, but it doesn't often happen the same way, or the relationship isn't there. And I was thinking up, I would have never gone to someone and asked them to be my mentor. It wasn't in me. It's not in me to ask that even now. Like it's one of those things that I think can be really challenging to ask for. And I think Dr. Alade really eloquently stated that why it's important to have mentors and what mentors can give and provide to you. And do I have advice on how to go and get a mentor? Not particularly, because I struggled with it myself. And again, it really emerged organically through collaborations and working with more senior academics and colleagues who had experience, and I learned from watching them and what they did and emulate them, and would then gradually go and ask more questions and personal questions to them, and have now become sort of a champion for me in certain places. And I realized how important that was in the career, but I didn't have it for a very long time. So I think, those of us that are trying to identify who might act as a mentor, give yourself some grace when you're in that process. Think about just maybe asking people for career advice or asking about key challenges, and then seeing, allowing space for those relationships to emerge organically when they're not sort of mandated by your place of profession. I think you can also find mentors in more established networks like Women in Global Health, Women in Lift, that has already been mentioned as well. But yes, and then those of us that are more senior, to think about how we can actually be mentors for other women and remove the awkwardness and the difficulty it is for women to find mentors. Can we step up to be that alleyway for them to help, navigate some of those challenges?
So I have a couple of reflections on this topic. The first is that your mentor doesn't have to look like you. And so when I think about the first person who mentored me, I don't think he thought he was my mentor. I don't think I thought he was my mentor. It was a peer who was exactly my age. I don't know if you remember Joe Vita, Yvette, but he was a tall, taciturn white man who lived in the suburbs, was, chief resident of this, that, and the other thing, had a stay-at-home wife and did cardiac catheterization. He and I had nothing in common, except for we were interested in the same scientific topic. And as I mentioned, I had the good, the bad, the ugly, and the evil, and he took mercy on me and helped me write my first R01. So people can be your allies, and they can really be instrumental. They don't always have to look like you. And, I think it really brings up the concept that we have, in my circumstance, it really hasn't worked having one mentor. And I encourage my mentees not to have one mentor. Diversity is an inclusive excellence imperative. I recommend that everybody try to get a mentoring team, and you get different things from different people. The second thing is, I want to mention the power of up mentoring. Many of my mentees have taught me a profound amount. They've gotten me, my slides look better because of my mentees. I understand something about social media because of my mentees. I think we ignore and don't pay enough attention to how much we can learn from those we mentor. The third comment that I would raise is that in any mentoring relationship, it's critical to have an open and honest conversation about expectations and where things are going well, where things aren't going well. I really am a big believer in calling in. Sometimes I can step in it, and I expect my mentees to show me compassion, and I will show them compassion. And then the final thing is, sometimes we get in over our head. And I reached a context in the early 2000s where I was in, around 2008, where I was in over my head. I was in a very politically fraught situation, and I hired a coach, and I credit the coach with saving my career.
Thank you. So before we turn over to the audience, I want to ask the panel about the current moment that we're in. Certainly, that is in addition to the challenges of finding that mentor and creating that team in that environment. How is the current moment both impacting the work you do, but also how do you see that either diminishing or interfering with mentoring efforts?
Yeah, thank you. When I reflect on the current moment that we are in, the different shifts that are happening in the public health, in the global public health space, We're having shift in global financing approaches, with funding being cut off for different programs, especially programs that affect gender, related to gender, to women's health. We have transitions in demographic transitions happening currently. We have a change in epidemiological, we're having epidemiological shifts. And so within this current moment of different transitions in financing, in demographics, in epidemiology, it makes me to reflect on how the gap in financing for women's health, for gender programs, how do we develop mitigation plans that helps to sustain the gains that have been made? And also, how do we ensure that we continue to finance? How do we look for sustainable financing for these areas, critical areas that are currently receiving reduced funding? And then within the current shift, we see that with the shift in financing space, we see that women are losing, quite a number of women have lost their jobs. And so women in leadership position within the space who have been involved in policy making, in designing programs, are no longer there. And so I'm sure if we do an analysis of those that have been affected, we'll see that quite a number of them are women. And so how do we mitigate against this affecting the policy, affecting the number of women in key leadership positions that would drive the changes that we want in the global health space? So that's one thing I would say it's my own reflection on what is happening right now. How do we sustain the financing, and how do we ensure that women have lost their leadership role, or even their work opportunity can be re-engaged, or we can increase the number of women in leadership role during this critical moment in global health space?
Okay, maybe I'll go next. So I feel like this is a profoundly challenging time. When the plane crash was blamed on DEIA, I woke up the next morning and literally started weeping, and was weeping off and on all day. And I am somebody who's had a lifelong anxiety and depressive tendencies. And so it's, my resilience has been a daily journey and practice. And so I started personally with a mantra where I say every day to myself, focus on my breathing, my sphere of influence, get my work done, retain a sense of humor. When I found out they were going to do criminal investigations of people who did, or institutions that did diversity work. And I think another piece that our president of the university focuses on is be kind. And so that's what I'm trying to do in my daily life. In terms, the thing that I have keeps me up at night is losing a generation of investigators. Yvette and I, one of our colleagues who I have a teeny piece of funding on their grant, got their grant canceled yesterday. One of my mentees got his grant canceled 2 weeks ago. And, my next promotion's emeritus. And what happens to me and my funding and whatever, doesn't matter. I have profound concerns for researchers in the United States, particularly our early career colleagues. And, I think all that any of us can do when we're faced with a crisis is try to pivot, be resilient, nimble, apply for alternative funding streams, and think about how do we as public health practitioners communicate our values because I really think fundamentally people do believe in equity. Fundamentally, people do believe that everybody in our country should have access to health care that's high quality. And so, you know, it's an opportunity to try to figure out how do we focus on what we share in common. And the final thing I'll say is only 17% of Americans think that Medicaid should be cut. Less than 40% of Republicans think Medicaid should be cut. We have much that unites us as a country, and let's focus on that.
Great. Yeah, I really share the concerns of my fellow panelists. I'm not quite sure how else to say what has already been very eloquently stated. The very much worry for our, you know, current scientists and emerging scientists and social scientists and the pipeline coming in, especially in public health and global health, and what does this mean for careers and especially early careers. I'm also very much concerned for the status of research on women's health and gender, because as I've mentioned, you know, the same as in leadership, people tend to prioritize what is of interest and them or related to their lived experience. We do see people tend to research the similar things. Women tend to research women's health. Women tend to research gender inequities, and the US is a huge donor in this, not the only donor. So yes, we do need to diversify funding sources. We do have to try to think about how we are going to sort of weather this storm. You know, we had so many gains in the last 15, 20 years in women's health, you know, in advocating for women to be on clinical trials and advocating for research on specific women's health issues, that we really need to keep up this fight. And, you know, a silver lining is this really has shown and emphasized the importance of our work, you know, and the need to keep moving forward to battle this storm, to ensure that these issues remain on the agenda and that somebody is doing this work and that we're bringing up others alongside us when we are doing that, because I think it's going to be a challenging next few years for those of us in global public health and public health more broadly. And, you know, we need to sort of come together as a community to get through it.
Oh, thank you for that. Yeah, so I'm going to switch now to some of the questions that have been posed by our audience. One of the first is a comment and a question. So we expect that women, given certain opportunities, might open the door for other women through sponsorship and mentorship. However, commonly we see women, once they attain certain levels, adopt characteristics similar to those, creating those barriers for women. How do women break through the invisible glass barriers in organizations where women are not seen as competent by virtue of them being women? So anyone want to take that all or in part, or sort of the phenomena that some women become?
I know people write a lot about the queen bee phenomena, where the queen bee basically kills those around. That has, you know, maybe because I'm a cardiologist, that hasn't been a huge part of my experience. I acknowledge that it happens. I mean, the reality is they're jerks, and they're women jerks, they're men jerks. I think that we have different expectations for women, which doesn't excuse it. The way I'm fond of saying is men can operate between here and here, and women have to operate between here and here. And basically the here and here is either you're a bitch or you're a doormat, pardon my language. And so I do, you know, for years, I've had, as Yvette knows, I've had something like 6 360s, not for the faint of heart. And we are held to a different standard. Having said that, I think my biggest joy as a woman leader is helping the next generation. And that's women, people with who have been historically and structurally minoritized, and frankly, shy white guys. You know, that's my joy, that's my honor. And, you know, I also think we have to have compassion for people. People are trying to do the best they can. There aren't that many jerks out there. But you know, I may have a different perspective. I'm probably generationally tone deaf.
Yeah, I always like to say that women can be just as big misogynists as men. You know, it's just because we're women, it doesn't mean that we haven't internalized a lot, you know, inequitable gender norms. We're part of the societies, you know, in which we grew up and live and work, and we all internalize the underlying gender norms, you know, on what makes a good leader, who is a good leader. Women, as Dr. Benjamin said, are held to a different standard oftentimes. And, you know, so these hidden gender bias or unconscious gender bias exist within women. Sometimes women, we see this sort of survival mechanism that in order to keep my role, in order to be seen as a good leader, I must then demonstrate these traits that are often seen as quote unquote more masculine leadership traits. And it happens, right? And we have to, as individuals, do the work to unlearn those gender biases ourselves. And we are up against that, and sometimes thought of as not good leaders because we try to navigate a different space. So we need, I mean, it really comes to not only internal individual shift, but we need organizational and systems shift to different, like training around this, the organizations to recognize this as well. So we must be looking to make change at the institutional level as well as at our own individual level.
I also agree with Emelia and Rosemary. Definitely, we are held to higher standards than men. And for me, I think also when we work with other women leaders, is also understanding what they are going through. I'm not making excuses for women and all of that, but you know, women we wear so many hats, dealing with family, dealing with work, dealing with so many things. And sometimes it takes you really stepping back to understand individuals, to understand what they are going through and understand what their leadership style is, because people have different leadership styles. Men, they can just up and do anything. Women, sometimes some of us are overthinkers. We overthink everything, we overanalyze everything. We want things done in a certain way. And so really understanding the person you're working with, sometimes I feel really helps to navigate that in the workspace. Not making excuses for people, but I hear this a lot, women are the worst set of people. But then you find really good women that you work with and you're like, oh my God, where has this person been all my life? And they're there to support you. And I think it also has to do with confidence as well. You know, sometimes people will struggle with their own self-esteem, tend to put other people down. And so really understanding where people are coming from and learning to work with different people through their different challenges might be helpful. For me, one of my principles of leadership is reciprocity, meaning that whatever have been given, I have to pay it forward. And so learning to also support and draw other people as I climb up the leadership ladder, also supporting the early career, younger team members that are coming after me. It's something that I try to do. It's not easy, to be honest, but really that it's challenging, right? But it's about communicating, understanding who you're working with and paying it forward. I think that has been one of my own leadership principles, paying it forward. Whatever I've learned, whatever ways I've been supported through my career journey, I try to pay it forward to those coming behind me. Thank you.
Very good points, paying it forward. So just to follow up on something that, you know, you all mentioned a bit, but first, you know, the very narrow frame and lens in which women get to operate in terms of personality, right? So either being a doormat or the other, right? You know, there are sometimes cultural differences in how that is. So some, you know, settings where women, you know, fully competent women aren't, you know, encouraged to speak up, and if they do, they are put into that frame. So, and then, you know, then the other question is around confidence in that space. So what advice would you give women who are either in those cultural constraints or maybe genuinely lack confidence to step out of those constraints, even when they're in a less constrained environment?
If I can start us off this time. It's, well, tricky build, you know, things around like how do you build confidence? It's, you know, I think imposter syndrome is real for sure in a lot of this work. And it's really through sort of being practicing and being prepared. You know, I think so many times I've stepped up and I haven't done a good job, or I've been so nervous. You could hear it in my voice, you know, especially in my career, but just, you know, getting through it and knowing that through that repetition and practice that you do get better, and then not being afraid to fail. And I think Dr. Benjamin put that really well too, about the importance of that in our career trajectories. I think it's definitely different cultures, or even different identities. There's different you know, what women of different races and ethnicities are held to different levels than so Black women, Hispanic women held to different levels than white women, right? Often, and that we do have to recognize that, right? We all have our different privileges and different, and how those look is different in different settings. For those of us that might really encounter that resistance more, it's, you know, what I try to do is just be as professional as I can, be as prepared as I can, using data and evidence to back up what I say as much as I can. Sometimes environments are just really toxic. There's, you know, protecting yourself and your well-being is extremely important. You know, removing yourselves to sometimes from those environments is important. Having a really supportive network is hopefully within your career, within your institution, you know, and somebody that can interject if needed potentially, but people outside that you could just talk about and navigate, and just not giving up and being persistent. You know, we're not going to often change the practices of others and how others sort of will see us, so we can only really change ourselves. I mean, I'm a strong advocate and pushing for institutional systemic change, but we know it does not happen overnight. So in the meantime, we need to do these other things, and the confidence too, like joining those networks, like the women, apply for the Women Lift, right? Be part of Women in Global Health if you work in that space. I included a link to a Hopkins network that's open to anybody for emerging women leaders in the chat. So just be building your own communities that can really help you navigate those spaces.
Let me come. Okay. Yeah. For me, for the confidence part, yes, I hear you, Rosemary, on the imposter syndrome. But I think what has helped me to be able to overcome that, I've worked in 2 different settings, I will tell you, is the peer mentorship. And the first one, when I felt like I really had imposter syndrome, was the lack of peer mentorship within team members, having, you know, your colleagues who support you, who tell you, oh, don't worry, it wasn't that bad, or give you honest feedback and say, you could have improved on this, or let's practice before you go ahead and make that presentation. Let's look through it together. Having that network within your workspace, you know, your peers, working with your peers, I think that really makes a lot of difference. And I will tell you, in my current role right now, I really don't feel that. And I will say it's because of the peer mentorship, the culture within the space that you work in, the culture that allows you to fail and improve yourself, that doesn't judge you, that there's no punitive action for failure, right? Failure is for you to learn and grow. When that's the culture and that's the orientation within the workspace, I think that really goes a long way to help build confidence. Thank you.
So along the lines of imposter phenomena, I became an honorary doctor for Augsburg University. And it happened randomly that the 4 people that were inducted were all women. And I read their bios and I was like, man, what the heck am I doing here? And so like towards the end of it, I asked them, I said, did anybody else read the other people's bios and said like, they made a mistake when they picked me, And the reality is here are all these incredibly powerful women and like all of them, admitted, yeah, I kind of was like a little weirded out, So I do think that that's also partly just comes with humility. I still have it sometimes. One thing I would say, and something I'm working on, is I'm fond of saying that I'm a recovering perfectionist and recovery is not going well. And I speak to myself in a way that I wouldn't speak to my worst enemy. And I think that most of us are very, very compassionate towards our friends. And if I have one regret as a parent and as a mentor, is that I didn't model that same compassion towards myself. I think it's really a problem, and I really wish I hadn't. In terms of this piece of, speaking up, advocating for yourself, etc., like I said, we really have to thread the needle. And one of the things my coach told me years ago is she said, look at Emelia, do you want to be right or do you want to be effective? And, I mean, Yvette's known me long enough. She's seen me get on my high horse, right? And, yeah, I'm righteous, but I'm not right in terms of accomplishing what I want to. And so increasingly what I'm trying to do is lead with curiosity and assume good intent and try to figure out what do we have in common and how can we find common purpose and move forward.
Can I just quickly jump in? When you were saying it made me think something I should tell myself a lot when I do have imposter syndrome is just to tell myself I deserve to be here. I have something to say, or else I wouldn't have been invited, or I wouldn't have been in this space. And I tell myself that a lot. And then I sometimes have to force myself to speak up in some certain spaces because of how daunting it is. But I find that does help to reinforce and counteract some of the imposter syndrome that is present.
Yes. Let me just quickly come in. Emelia, I hear you loud and clear on the self-compassion. Really, I think sometimes we're just too hard on ourselves. We tend to have compassion on others, forgive others of their shortcomings, but then we self-reflect and then it turns into something else. We just keep going and on and beating down ourselves when we should actually have compassion and say, you actually, given the circumstances, you actually did a good job, and pat yourself and then move forward and learn from our mistakes or failures. So yeah, thank you for sharing that.
Yeah, so thank you. I mean, the key for me is, in the way that I'm getting out of this pit, is what did I learn that didn't go the way I wanted it to? What did I learn? And that's enough. And that's a beautiful thing. Every day we have an opportunity to learn.
And just sort of, following on that, that sort of, affirmative self-talk, how can we, either through pipelines or organizations, organizational culture, keep women from burning out, women leaders? Because, which you said, sometimes our greatest battlers are ourselves, but also dealing with the other inherent issues within the workplace, sexism and so on. How do we keep from burning out, and how can we help those in the pipeline?
I mean, to me, this is partly what I was trying to talk about with resilience. What works for me isn't necessarily going to work for Dr. Morgan and Dr. Alade or Dr. Cozier. And we each have to find what it is before we're in crisis, what it is that feeds our soul, that helps us keep moving forward. And for me, a lot of it is I go on a lot of walks, and I can't meditate. I'm a meditation failure because I've got ADD and I'm too twitchy, but I can breathe, and I focus on my breathing and body scans. And for me, one of my biggest sources of resilience is trying to practice being kind. And so when somebody gets something, emailing them, congratulate, little teeny little micro affirmations, I'm interested in what Dr. Morgan has to say and Dr. Alade has to say, and also you, Dr. Cozier, because, you know, I think the other piece we have to do is how do we create more resilient institutions? And, you know, part of that is, you know, we are in for 4 tough years. Like, let's just, you know, in the United States, buckle up and let's just keep looking out for each other and keep being kind to each other. You know, our institutions are going to fail us. And it's not for a lack of caring. It's like we're in a global stress test.
Yeah, this is a hard one, and I need someone to tell me how to reduce burnout, because it's real. And not just burnout, but like how to deal with anxiety, you know, given the current situation. Could really use advice on that as well. It's for me, it's around building a really supportive team and collaborators at work. So all the burden isn't just on me, and that we're working together and we like co-work, which is way more fun than just doing it on my own. I mean, most of us are at a computer that aren't in medicine with practicing or at a computer every day. And like the only little bits of interaction we get are like teaching or going in for a faculty meeting. So you know, trying to have those in-person connections, but trying to have, you know, have spaces where you can work, and then also to honestly to have people you can complain and moan to when things aren't going well, and as an outlet that like that you can do so safely, because we do need to be able to share those. I have been to different sessions around women's leadership in the past, and something that someone said to the group, not me, that struck with me was about choosing your partner really wisely in just thinking about as emerging women leaders, because of someone mentioned in one of the questions the dual burden that women have, which is so real and it's still here, and it's because of our embedded gender norms in society that women are expected to do the caregiving both of young children and older parents, and you know, women are expected to follow men who get promotions and not vice versa, and things like that. So choosing your partner is actually one of the biggest decisions that you make. This really struck me, and to say, you know, I feel that's true, you know, that to get that support in the home, and then also to think about how you might be able to outsource some of this work if you can, as it, you know, as needed, so you are not overburdening. If you don't have that support at home, what can you do to reduce the level? Because we do need to take care of our personal lives as much as we do need to take care of our professional lives. Family, supportive colleagues, all of that is really important.
I think for me, in being able to prevent burnout, I think it's 2 things. One is the supportive network within family, having that supportive network, as you mentioned, Rosemary, having supports back home and having people that can really take on some of this work for you. Outsourcing sometimes can be very helpful. And then apart from the informal support network, the formal networks in terms of women network that can support you. Examples like the emerging women leaders, the Women Lift Health, having those platforms that you can share some of your challenges and hear other women talk about all their experiences within the workspace and how they've been able to navigate it, even the burnout, right? Sometimes it's very helpful. Secondly, for me, it's the expectation, setting the right expectations for oneself, you know, and not comparing yourself to other people. I mean, it's good to set targets, but be realistic. For someone like me, I used to call myself a type A before I had kids. Before I had children. Now I'm no longer a type A personality anymore. But, you know, sometimes we are too hard on ourselves and we set target because of other people's achievement, or like, oh, I want to be like this person. Or it's good to have to aspire to be like other people, but you also have to remember that it's a journey, right? It's a journey. And so taking steps to get to that journey. It doesn't happen overnight. And you know, celebrating the little milestones. For someone like me, I look at the end target, like, oh, I want to get this, and the different milestones along the way that should bring me joy, and, you know, celebrating those things. Sometimes I forget to celebrate them. And sometimes those kind of things, when you don't celebrate the little milestones and you are just focused on the end goal, you tend to get overburdened with accomplishing that task, and then you don't enjoy the process. And that sometimes brings up burnout. And so I feel like setting the right target, enjoying the milestones as you go on this leadership journey will be very helpful in managing work-life balance and even the burnout. Thank you.
Yeah, I really agree with that point. I think that's really wisely said. You know, a couple of things. First, I agree with Dr. Morgan that who you partner with is, if you have a partner, is really important. And I don't know if you've ever read this book. I don't have royalties, but it's called Drop the Ball by Tiffany Dufu. She's an African-American woman. And she talks about how she thought that she needed to be superwoman. Like, you know, and, you know, brilliant at home and brilliant at work and brilliant in community and, you know, And then she like completely burned out and she renegotiated her relationship. And I do think the average woman on a career development award in the United States, according to Dr. Jagsy, when they did an analysis, works 8 hours a week more on their at home responsibilities than if they're partnered with a man than their male partner. And that's going to lead to burnout. So I do think that we have to have realistic expectations. And I don't know about you, like my home is not spotless. Okay. Just saying. And then the other piece is both my kids have struggled at times. And if I had a child struggling, I found that, you know, obviously that's really, you know, you don't want to admit that as a working woman, but I have had children struggle. And the years that my kids struggled, guess what? I didn't get much done, and that's okay, because at the end of my life, I didn't say, wow, I wish I'd gotten promoted a year earlier. You know, life, it's a marathon, it's not a sprint.
Absolutely. And Dr. Alade, you mentioned the word joy. And a few weeks ago, a colleague shared leaning into joy. And so I looked it up, and it was the Black poet Joy Derricott who wrote that joy is an act of resistance. And so how we lean into those things that fulfill us, that give us joy, if it's our work, it's going back to the reason that we're here, perhaps, that will help us through the darker and the harder days. So we are almost at time. If there's like a 30-second wrap up that each of you can offer to those listening, to those students in public health, in medicine, what would you say?
One thing I would like to part away with, key takeaway for me will be understanding that leadership doesn't necessarily have to come with authority, influence. So wherever you are, the influence that you can provide, make changes, it's leadership as well. So it's not until you're given a specific job or an authority that you call it leadership. It's the influence. It comes with influence. How can you make impact whatever you're doing? How can you change lives? How can you make changes to policies? How can you, whatever the little that you're doing, how can you impact people? So it's the influence and not authority that it's leadership. And so that's what I would like to conclude. And I'll conclude with thank you for having me.
I would conclude that I really appreciate the wisdom of my fellow panelists and the honor to speak. And I think Nelson Mandela said it well, you know, I never lose. I either win or I learn.
And I would conclude just by sort of challenging you to find your own style of leadership that might go against what standard sort of stereotypical leadership is. You know, leading with compassion, leading with empathy, leading with collaboration. Those are really challenging to do in a lot of the environments that we work in. And that you learn and you grow, you make mistakes, and just practice, 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 and you get better. decade of my life has been better than the previous one, and I hear that from a lot of people, and it will be the same for all of you, I'm sure.
So what a wonderful discussion. I like ending with joy. For the record, I am a male ally. I'd like to thank everyone for being with us today. Special thanks to Yvette for moderating, to the speakers for their insights, and to Veronica Wirtz and the BUSPH Emerging Leaders Program for co-hosting this event. We hope to see you at our next public health conversation taking place on April 23rd, which is our annual Shine Lecture on legal aid's pivotal role in patient advocacy. Take care, everybody. Have a good day.